All right, let's talk teeth. Our teeth are with us every single day, helping us eat, speak, and smile with confidence. But keeping them healthy isn't just about brushing and flossing. Sometimes we need a little extra help from dental medications. Whether you're dealing with a sudden toothache, a stubborn infection, or just want to keep your gums in top shape, knowing which drugs are out there can make all the difference. When it comes to dental care, there's no one-size-fits-all drug. Every mouth is unique, and so are the challenges we face. From cavities to gum disease, from sensitivity to post-surgery pain, the right medication can help you manage symptoms and speed up recovery. But it's important to remember that what works for one person might not work for another. The medication I need really depends on what's going on in my mouth. Is it pain, swelling, infection, or something else? That's why it's always best to get a proper diagnosis from your dentist before reaching for any medication. Self-medicating can sometimes do more harm than good, especially if you're not sure what's causing your symptoms. So, let's break it down quickly. We'll go through the most common dental drugs, what they're used for, and a few tips to keep in mind. Whether you're at home or in the dentist's chair, this guide will help you understand your options and make informed choices for your oral health. If I've got a toothache, my go-to is usually an NSAID like ibuprofen. Toothaches can be incredibly distracting, making it hard to focus on anything else. Ibuprofen is a non-steroidal anti-inflammatory drug, which means it doesn't just dull the pain, it also tackles the inflammation that often comes with dental problems. This makes it especially useful for things like sore gums, dental injuries, or pain after a dental procedure. It's brilliant for both pain and inflammation. Just remember to take it with food to protect your stomach and always follow the recommended dosage. Overusing NSAIDs can lead to stomach issues or even affect your kidneys, so moderation is key. Naproxen's another solid pick if I need relief to last a bit longer. It works in a similar way to ibuprofen but tends to stick around in your system for a few more hours, which can be a real lifesaver if you're dealing with persistent pain. Just like with ibuprofen, be mindful of the dosage and any other medications you're taking. Can't take NSAIDs? Acetaminophen's a great alternative. It's gentle on the stomach and doesn't have the same anti-inflammatory effects, but it's still effective for mild to moderate dental pain. This is especially helpful for people with certain medical conditions or those who are sensitive to NSAIDs. But here's a tip. I steer clear of aspirin before any dental surgery. It can make bleeding worse. Aspirin thins the blood, which is great for heart health but not so great when you're about to have a tooth pulled or any other dental procedure. Always let your dentist know what medications you're taking before any treatment. Now, dental infections like abscesses or gum infections? I'm not reaching for painkillers. I need antibiotics, and these should always be prescribed. Infections can spread quickly and cause serious complications if left untreated, so it's crucial to get the right medication as soon as possible. Amoxicillin is first in line, and it's often the antibiotic of choice for most dental infections. It's effective, well-tolerated, and works quickly to clear up bacteria causing the problem. But remember, antibiotics aren't for everyone or every situation. But if I'm allergic to penicillin, clindamycin steps up. It's a powerful alternative that covers a wide range of bacteria, making it a reliable backup when amoxicillin isn't an option. Your dentist will know which antibiotic is best for your specific case. Sometimes metronidazole is used for those pesky gum bacteria. It's especially good for targeting anaerobic bacteria that thrive in deep gum pockets or abscesses. Your dentist might prescribe it alone or in combination with another antibiotic for stubborn infections. Remember, antibiotics only work for infections, not just for pain or swelling. Taking antibiotics when you don't need them can lead to resistance, making future infections harder to treat. Always finish the full course if prescribed, and never share antibiotics with others. For gum disease, gingivitis, or periodontitis, I use an antimicrobial mouthwash like chlorhexidine gluconate. This prescription rinse helps kill bacteria that brushing and flossing might miss, especially in hard-to-reach areas between the teeth and below the gum line. It's great at reducing plaque and keeping my gums happy. Using it as directed by your dentist can help reverse early gum disease and prevent it from coming back. Just be aware that long-term use can sometimes cause staining, so follow your dentist's instructions carefully. Or, a diluted hydrogen peroxide rinse helps cut down bacteria and inflammation. It's a simple, affordable option you can use at home, but make sure to dilute it properly. Straight hydrogen peroxide can irritate your mouth. This rinse can also help with minor mouth sores or after dental procedures to keep things clean. Worried about tooth decay? Fluoride treatments are my best mate here. Gels, rinses, or varnishes all help repair early enamel damage. Fluoride strengthens your teeth, making them more resistant to acid attacks from plaque bacteria and sugary foods. Your dentist might recommend professional fluoride treatments if you're at higher risk for cavities. Some people also use calcium phosphate pastes for an extra boost. These products can help remineralize enamel and reduce sensitivity, especially if you have early signs of tooth wear or white spots. They're a great addition to your daily routine if you want to give your teeth a little extra love. After dental surgery, pain relief is key. Procedures like extractions or implants can leave your mouth sore and swollen, so managing discomfort is important for a smooth recovery. Your dentist will recommend the best pain relief based on your needs and medical history. I often combine ibuprofen and acetaminophen for the best effect. This combo targets pain from different angles, giving you stronger relief without needing prescription opioids. Just make sure you're not exceeding the maximum daily dose for either medication. Antibiotics only come into play if there's an infection, or if your dentist thinks you're at risk for one. Not everyone needs antibiotics after surgery, so don't be surprised if your dentist skips them unless there's a clear reason. And an antiseptic mouthwash can help keep things clean. Rinsing gently with a prescribed mouthwash or a saltwater solution can reduce bacteria and promote healing, especially in the first few days after surgery. Last up, dry mouth or sensitive teeth. These issues can sneak up on anyone, especially if you're taking certain medications, have had dental work, or just have naturally sensitive teeth. I grab a fluoride toothpaste designed for sensitivity, like Sensodyne. These toothpastes work by blocking the tiny tubules in your teeth that let hot, cold, or sweet sensations reach the nerves. With regular use, you'll notice less discomfort and more confidence when eating or drinking. For dry mouth, saliva substitutes or even prescription pilocarpine can really help. Dry mouth isn't just uncomfortable, it can also increase your risk for cavities and gum disease. Saliva substitutes come in sprays, gels, or rinses, and pilocarpine is a medication that can stimulate your own saliva production if needed. That's your speedy rundown on dental medications. From pain relief to infection control, from gum health to sensitivity, there's a solution for just about every dental problem. But remember, medications are just one part of the puzzle. Good oral hygiene and regular dental visits are just as important. But always chat with your dentist before starting anything new. They can help you choose the safest and most effective option for your unique situation, and make sure you're not missing any underlying issues that need attention. Look after your teeth, and they'll look after you. With the right care, the right medications, and a little help from your dental team, you can keep your smile healthy and bright for years to come. So don't be afraid to ask questions, stay informed, and make your oral health a top priority.